sometimes we find that there are contraindications, certain situations or conditions that people that would be prospective clients may be experiencing. And I have found that with my history of being in the aesthetics industry and being an educator, that there are usually two types of people that want to go into aesthetics. It's those that really like makeup, and then there are those that really want to help people. Our guest today is going to be one in the latter category, although I think she likes makeup too. But we've got contraindications, and I'm going to go ahead and say it. I'm going to say the cancer word. Cancer. That has been a contraindication for a lot of the aesthetic treatments up until now. And there is a new certification and training that is going on. It's not certification, it's a training for licensed estheticians worldwide, I think, that are trained how to work with someone that is going through treatment of any type for cancer and do it safely. So the one that has the answers to all of this, the founder of Oncology Spa Solutions and the trainer, the head trainer worldwide, and I see you in our skin magazines as well. Becky Kuehn, welcome.
Thank you, Jill. It's fabulous to be here with you today.
I started out with what the contraindications, because we have those on basic training for estheticians. Now, you train people through your program, Oncology Spa Solutions. And by the way, you authored the book. You wrote the book, right?
Well, I did write a book. I wrote a book called Changing Esthetics, because I
Yes.
believe that when you start working with cancer patients, it changes lives. The person you're working with and also the person giving those treatments. It kind of changes the perspective on what we do.
It does indeed. Since this is not really audience specific, but medical professional, general consumer, licensed estheticians and cosmetologists, and also massage therapists, right?
Right.
Esthetician and cosmetology students. It's a basic overview that we're going to discuss today about the what it means and what it takes to be oncology trained uh, professional in the body and skincare industry.
Okay.
Wanted to start off with medical professionals. You do work with quite a few medical professionals, excuse me, and you've trained your students and graduates and licensees about working with medical professionals, whether it is an oncologist or a dermatologist or any kind of physician, nurse practitioner, physician's assistant, working with the medical industry then, and to inform the medical industry about what we do as oncology trained estheticians, right? How did that start?
So for me, it started with volunteering. I was volunteering at a local hospital as an esthetician within the Look Good, Feel Better program. And that brought up a lot of issues and questions. And if you're familiar with the program, it's a one-time workshop for a couple of hours where the patient gets to come and learn about how to take care of their skin when they're going through cancer. And what we very quickly realized is, as you know, you can't fix a skin condition in one little 2-hour workshop, and especially when it's really not one-on-one. There was usually 8 to 10 women in this group. So it really got my wheels turning, and I presented to a local hospital that I was doing this volunteering in. I said, could we use a room and really, really dive deep into helping these patients with what they're going through? And luckily for me, they saw the vision and they supported me in that. So we started right away working with patients, being a part of that circle of care in cancer care to help with the side effects, because everybody knows there are side effects, but not everybody within that circle knows how to help with those side effects, and especially when it comes to skin-related issues. So kind of a fun story. I started with a lunch and learn for a whole team of radiation and oncology chemo nurse team. So there was 2 doctors and about 10 nurses in this room. And I started to just tell them what it is that the cancer patient goes through, how their skin is impacted, and how an esthetician can help them. And it's funny because I talked a lot about the cancer and about the side effects and the medications and the things that can cause these side effects. And when we were done, a nurse who was the head nurse in the chemo infusion area came up to me and said, "Wow, I didn't know estheticians knew so much about skin." I thought she was going to say cancer, but she said skin. And we hear this all the time. I don't think people really know what estheticians do, that we really are skin care specialists, and we understand the functions of the skin. And when you're trained properly, our goal is, how can we support the skin, right? Largest organ of our body, already knows how to function. It's just got a little bit derailed because of medication and stress and things that a cancer patient goes through. So how do we support that and help them through that journey? And so that was really interesting. But after that kickoff, we ended up just really filling up the treatment room. They started sending all their patients our way. And that was great because we got to really test out a lot of things that, we hadn't been able to before within the medical realm, and also prove ourselves to the medical team. So that was really fabulous.
When you mentioned testing out some of these things, what was the process? What were you testing out? And what was the process?
Well, it was basically working with the cancer patient, right? Because you said this in your intro. In our industry, it was a contraindication to work with a cancer patient, right? Up until 2019, when I was asked to make that amendment in the Milady book. When that happened, that changed a lot of things for us. But prior to that, it was a contraindication. So when or how could we ever have a client that we could bring in and try whatever protocol it is that we came up with to see how it was going to work on a cancer patient? And that's what I meant by testing out these protocols, because we know the skin, we know how it functions, but we also know that when somebody's going through cancer treatment, the skin is a little mixed up. It's so busy fighting to protect everything that's going on within the body that it really has a lot of additional skin conditions that you don't see on a normal, healthy client. So, we're talking about some rashes. We're talking about extremely dry skin. We're talking about redness, sensitivity. We found that a lot of patients, when they came in, whatever products they'd been using for 10 years, 15 years that worked fine before, were no longer functioning or working well when they were going through cancer treatment. So that got us on the whole path of, let's look at ingredients. And that's really where we started. So let's look at ingredients in personal care products. And let's find out what's maybe exacerbating some of these issues and conditions, and what is helping some of these conditions. And so we started there and just had such great results. And I know the patients were so happy. They'd go back and tell their doctor and their team, and their medical team would be so happy and, tell us how happy they were about that. So it kind of started from there. And I'll tell you, that was about 15 years ago. And that was in 2 local hospitals here in Washington State. We are now in over 23 hospitals and cancer centers, and we've got a big program that's rolling out, a pilot program starting in October. So it keeps moving forward, slowly but surely.
Yes, there are so many companies that offer products, skincare products and everything. And you have developed some, since you mentioned something about things here are some for that, yes, and you have developed some products that are specific.
Correct. Well, here's a thing that I found in the very beginning, and I used to teach my students this as well. Don't listen to marketing, right? Because everybody wants to say they have a product that can be used on a cancer patient, but that's not necessarily true. And I'm not going to name names, but there are several lines that market they are oncology safe, and they literally have, if all you have to do is turn the bottle around, look at the ingredient deck, you will see they have products and ingredients in that product that are not safe for anybody's skin, but absolutely not a cancer patient.
Yes, and read, where's my camera there? Read, there we go. Yes, read the ingredient list. That's what I talk to my clients about all the time. I wanted to back up a little bit here, Becky, please, because you had mentioned the Milady book. You contributed to the newest last two editions, I guess, of the Milady book. And I wanted to, for our viewing and listening audience, I wanted to explain that Milady book is the book of training for cosmetologists and estheticians, and it's approved. Well, I don't know if it's through North America or just United States or if it's worldwide, but that is what we teach from. That's so I wanted to clarify or
Right.
explain a little bit about that, what Milady was.
Was. Right. And the amendment was, yes, you can work on a cancer patient. However, you need additional advanced training. So no longer are we saying a hard line, no, you can't touch or talk to a cancer patient. We're saying, yes, you can, as long as you add an additional level of training, which I think is really important.
Yes, it is, and that's an advanced training too. Usually, after someone gets their the basic training and their license, then they go on to in advanced courses.
Correct.
You know so much about this, so much. I want to hit on two things. I'll just ask you a kind of a double-edged question here. Treatment does not mean just chemotherapy. It can be surgery. It can be radiation. Can you mention some of those and then explain your experience when you first got married?
Okay, so you're correct. There is no norm, again, for a protocol for somebody who has cancer because everybody is going to have a different type of cancer. Everybody's going to respond differently. They'll have different doctor teams who are going to approach it in a different manner. So, that's where we all need to, I think, be little skin detectives, right? We need to ask questions. What is going on with this person? What have you gone through? Because somebody who had a lumpectomy, removing just a tumor, is completely different than somebody who had a full mastectomy, followed by radiation and chemotherapy. And now we're in a place where, although a lot of the medications are the same that we've had since the 1950s in cancer care, there are some new things that are happening. And unfortunately, we're still seeing some side effects that are affecting the skin, right? So your biotherapy or immunotherapies that are out, they're working quite well, but they do also create some side effects that we need to step in and help with. And, one of the things, Jill, is that when a patient is going through cancer treatment, and really their fight should be the fight of their life, right? If there's
Yes.
going to be a fight, it shouldn't be a fight of how do I care for my skin and I don't know what to do with that, and now I can't go outside, or I can't work, or I can't have a conversation with people without them looking and asking me questions about what's going on in my skin. And so, that's where it becomes important. It's not a vanity issue. It actually gives that patient back their privacy. So if they want to go through this journey on their own without telling the world that they're going through cancer, then they need to be able to appear at work and look like themselves, feel like themselves. And it's a very, very important quality of life issue.
I have people that ask me occasionally, how many women do you have? And are there so many women in Sulphur Springs that come for a facial? Women, men and women. And the oncology trained esthetician most often treats men and women. It's not just women.
Correct.
Right.
Correct. And something new that's come up, and this is kind of heartbreaking, but twice this week, I had people reach out to me and ask how young or how old do you have to be to come in for a skincare therapy because they have children going through cancer. So it impacts everyone. Doesn't matter what age, it doesn't matter your gender, it doesn't matter your race. Cancer just is going to affect each person as they go through it. And yes, they'll each have a different experience, but they will all experience something as they're going through that. Yeah.
Now, you had an experience when you were very young and had just gotten married.
Right. So I was on my honeymoon Married at 18, 1 year out of high school, married my high school sweetheart. We'd been together for, dating for 2 years. We had to wait. And in fact, we wanted to get married right out of high school, but my dad made us wait 1 year. So we waited that 1 year. And on my honeymoon, I ended up in the hospital. I had been bleeding for about 3 months prior to the wedding. And when I had gone to my GP, he said, "Oh, that's normal. That's just stress." Really? Having a period for 3 months is normal? Okay, if you say so, because remember, we believe what our doctor tells us. And of course, sometimes we want to believe what our doctor's telling us, right? I would rather him tell me that was normal than me thinking that it was something really scary. So I ended up in the hospital. They didn't know what was going on then. It wasn't until 2 weeks after I got home that I got a phone call. And it was my GP telling me that they had found that I had a very rare form of uterine cancer. And he said, "We're going to refer you to the Swedish Institute, which is the Tumor Institute in Seattle, and one of the biggest ones at the time here." And so I went down there to hear, the news that I had this very rare cancer that only one other person that they knew of at that time, this was in 1982, had this form of uterine cancer. And so they weren't really quite sure how they were going to treat me. And again, as a patient, nobody wants to hear that from your doctor. I want them to tell me, "I got this. I know exactly what to do," right? Which put me on a course of chemotherapy. And we kind of went down that road for a little while. And those that know my story, they know that I'm a Christian. And I really believed and prayed for a complete healing because I felt like I had a future.
Yes.
And I didn't want it to end at age 18, right? So I ended up having a remission, is what the doctor called it. And I've been cancer-free ever since. So, that's the great news. And I also know that because of that whole scenario and journey for myself, that's what started me on this path of trying to find a way to connect what I do and love for a living, which is, cosmetology, skin and hair, and connect that with somebody who really needs that help, somebody going through cancer. So it took a while to kind of put that program together, but we put it together, and we've been trekking now for about 15 years. I think I have over 7,000 grads, which is fabulous. So I call them aesthetic angels or healing hands. We've got 7,000 pairs of healing hands out in the US and globally. And I would really like that number to be much, much bigger. So that's my goal. Really get the word out. Yeah.
It will be, and with this video podcast being shared, it will spread the word even further. And yes, it was a divine thing. You experienced something, God led you through it.
Yeah.
And
For a purpose,
it's
right?
so that it can help not so many others like myself that are estheticians that are oncology trained, but also for all of the clients that would like skincare and think that they've just got to hide or that they've got to suffer through with skin situations besides what they're already going through just to get well.
Right. Right. When you
And,
think about it, it's so simple to really help them at this point. It's really giving them comfort in their own skin. And when we do that with the right products, making their skin comfortable, that allows the skin to do its own magic. And then it heals and it does its thing. But it looks better on the outside. The patient can go to work. The patient can function in life. They can go to the grocery store and not have people stare. And that, like I said before, it's a quality of life issue and a privacy issue. And I love that we are able to help with that.
Now, on the consumer who would benefit from this specialized modality, then do you? I know there's a link in the description. There's a link in the description of how to find you, get in contact with you. Is there a list of oncology trained estheticians?
So not quite yet, but so right now
Okay.
I'm the connector. So if there is a patient out there and you would love to find somebody who is trained and can help you in your area, all you need to do is send an email to me, which is Becky@oncologyspasolutions.com. And then I can connect you with a couple of different people in your area and you can interview them and choose the one that works best fit for you.
You're a very busy lady.
I am. I know. I'm trying to figure this out, Jill. But and I do have help, so that's a good thing. But there are certain things that I like to keep my finger
Yes.
finger on, right? And that is really being in the pulse of what's happening on the patient side and what they need and how we can help, because that helps me to update and upgrade my program and training programs so that I'm making sure that the tasks that I'm teaching are really what is needed for a patient out in the real world.
Now we have estheticians and licensees and cosmetologists, even massage therapists, um, and students that have not made all of their hours yet and passed state board licenses. But if someone is interested, then it's the same thing in your training.
Correct.
And the
Yep.
oncology training, then they can get in touch with you also at Becky at oncologyspa
Correct. Yes. And they can actually take the course as a student. They don't have to have their license yet.
Oh,
We
good.
we issue a temporary student certificate, and then once they get their license, we just revise and update that for them. Yeah, and a lot of students do that. I will tell you something, Jill. This is really exciting to me, is that a lot of students contact me and tell me the reason they went to school is because they want to work with cancer patients. That's the reason
Yes.
why they went to school, right? We're seeing that a lot in aesthetics, hair, and in nails specifically.
Is there anything else you would like to add before we get into the closing question, Becky?
So one thing, and you and I kind of talked about this a little bit earlier, but I'm working with and collaborating with a doctor out of California. I'm going to be talking about it at Face and Body on Sunday in California, San Jose. It's a program called Prescribing Wellness. And we are going to do a pilot program with a large hospital group where we will be connecting oncology trained spa professionals. So that's the whole realm, aesthetics, nails, hair, massage, acupuncture, health coaching, nutrition, anything that has to do integrative for a cancer patient can connect with us with this program. And then the doctor actually writes a prescription. And that patient gets to go and have whatever the doctor says they need, a skin therapy, a wig, a massage. And that is either covered by insurance or covered by this group that we're working with for the pilot program. So we're super excited about that. We have, last I heard, this is kind of scary, but really exciting. We had 6 million patients who signed up on a waiting list. I mean, that just is amazing to me. So there's a huge need for it. And I'm so excited that we're going to get to test this out and then see where it goes from there.
I know, I'm so excited about that. I can't wait to hear the progress that's being made, and then of course the results and what becomes of this whole industry with oncology trained licensees in the future. Yes.
What I envision and what I'm seeing is, and I've wanted this ever since the beginning, was that we are a part of the healing circle in the care for a cancer patient. Because, you know, the doctor knows how to save their life, and the nurse knows how to make them comfortable and, you know, hold their hand and educate them on the whole process and everything that they do. Those are very valuable. We know how to help with the side effects.
Yes.
And, you know, what we're going to be teaching the people who are part of this program is, you know, the medical terminology, the medical grades, and what are in our scope of license so that we always stay in our lane.
Right.
We only are doing what we are trained and know. So for most of those skin conditions, we're working with grade 1 and 2. And the rest we are referring back to medical teams. So it'll be a real collaboration and really working with medical teams to ensure quality of life and wonderful skin for those going through cancer.
And the integrative medicine that you mentioned, I think that's something that is finally getting more attention.
Right.
Quite a few years ago, and before I was an esthetician, then I had a wellness center and was massage therapist and had a school. And I noticed that the foreword, I believe it is, in your book, is written by Dr. Gloria Gilbert. And I was
Yes.
familiar with her from like 25 years ago. So
She's been around.
Yes.
Yeah, she's fabulous in the integrative world. And I think that's, a shift that we're starting to see even in younger Western trained allopathic medical. They're starting to add more of those integrative things in, which I think is really awesome.
That's the basis of where we are medically today, from the history of the holistic and natural products. They've just been improved with science, which I'm very grateful for.
Yes.
Okay, we've got a closing question. Who or what has been your inspiration that has gotten you where you are today, Becky?
So, I've shared this story many times, but right in the beginning of me deciding to do this and working with the hospital, I was introduced to a gentleman who was going through stage 4 stomach cancer. His name was Jayton, and I call him my angel because of him. First, the inspiration. I knew I was on the right track. I knew I already wanted to do this, but because of his feedback and because of the way he responded to the services that we had with him while he was here, just really affirmed in my heart that this is a need, and it doesn't matter who you are, you're going to love it. Here was a gentleman that sometimes when I would go to see him, I would just put my hands on his head and just, in silence, be touching him. And tears would just roll down his face. And he would tell me, but also his family, how important and valuable the time that he spent with me was. And I realized that this is something that's really missing, because when somebody is going through cancer, they have a whole team, a care team of medical people around them, and they typically have family around them. But do they have somebody that really understands what's happening to their body, their skin, and are able to be there, help, sometimes maybe not even say anything, sometimes just that touch and or applying a lotion that they might not have even thought about. But he told me and reminded me many, many times how much he loved my visits with him. And I actually visited with him and probably about every week until the 2 weeks before he passed away. So being able to see the transformation in what we can do, I think so simply as an oncology trained spa professional, just to give of ourself, give of our heart by using touch, by listening, just by being with somebody. And I think too, it's important that you're a neutral person. You're not a family member, and you're also not the medical person. And so a lot of times they will share and tell you things that they might not tell anybody else. And that's valuable in itself, because they need to be able to share that. And I get email messages like that all the time that, says, wow, I'm so glad that I can talk with you about this. But it was Jayton who just kept me going. And every time things got a little bit rough, I just remembered how many Jaytons there were out there that needed us and needed me. And I had to make this happen. So I'm very thankful for him. I'm always inspired by God, who is my greater power. And I always spend time out at the hospital and just watch and see the transformation that happens when we spend a little bit of time with somebody going through cancer. It's so important.
And it's just the power of the human touch. Sometimes just the human touch, just the touch. And Jayden, we thank you.
Yes. Thank you, Jayton, for letting me into your life.
Yeah. You can find Becky. There's a link in the description. You can find Becky Kuehn. It is spelled Kuehn.
Yep.
Yes. Yeah. And pronounced Kuehn, right?
Right. Yep.
Becky, thank you so much for giving us this information and letting us into your life, and then providing this training that is available and this service that is available to healthcare professionals as well as clients and other licensees. So, Becky, thank you so much.
My pleasure. And thank you, Jill, for letting me share. Thank you.